As individuals age, their bodies undergo significant changes, and one of the most noticeable signs of decline is a drastic reduction in appetite and subsequent weight loss. This change is not just about losing interest in food, it is often a reflection of the body's decreasing ability to process and utilize nutrients efficiently. The digestive system slows down, metabolism decreases, and the body naturally begins to require fewer calories. While some may dismiss this as a normal part of aging, significant and sudden weight loss can be a critical sign that an elderly person is in their final stage of life. One of the reasons for appetite loss in the elderly is a decline in their sense of taste and smell. Food no longer carries the same appeal as it once did, leading to disinterest in meals. This sensory decline can make eating feel like a chore rather than a pleasure. Additionally, changes in the digestive tract, such as slower gastric emptying and reduced enzyme production, can make food less appealing and more difficult to digest. Over time, this leads to unintentional weight loss, which can be alarming for caregivers and loved ones. Another contributing factor is the body's reduced energy needs. As people age, they become less physically active and their muscles naturally shrink. With a decreased demand for energy, the body sends fewer hunger signals, causing seniors to eat less frequently. While this may seem like a minor adjustment at first, prolonged reductions in calorie intake can weaken the immune system, making them more susceptible to infections and illnesses. The body begins to prioritize essential functions, diverting energy from digestion to more critical processes. Underlying medical conditions also play a significant role in appetite loss. Chronic diseases such as cancer, kidney failure, heart disease, and neurological disorders can suppress hunger and accelerate weight loss. Many elderly individuals also suffer from difficulty swallowing, dysphagia, acid reflux, or dental problems that make eating painful or uncomfortable. In some cases, medications prescribed for these conditions can further reduce appetite, creating a vicious cycle of malnutrition and physical decline. Emotional and psychological factors cannot be overlooked when discussing appetite loss in elderly individuals. Depression, loneliness, and anxiety are common in aging adults, particularly those who have lost a spouse or close friends. Eating alone can feel isolating, leading to a lack of motivation to prepare meals or eat regularly. Additionally, cognitive decline, such as that seen in dementia or Alzheimer's disease, can cause individuals to forget to eat or become resistant to food intake altogether. Hydration is another key aspect affected by appetite loss. Many elderly individuals not only eat less but also drink less water, leading to dehydration. Dehydration exacerbates weakness, confusion, and organ stress, further contributing to overall decline. Since the sensation of thirst diminishes with age, elderly individuals may not even realize they are dehydrated, making it crucial for caregivers to monitor their fluid intake closely. When weight loss becomes rapid and noticeable, it often signals that the body is preparing for the final stages of life. The body begins conserving energy for vital functions, and non-essential processes like digestion slow down even further. This can lead to a cycle where eating feels more exhausting than beneficial, and the individual naturally begins rejecting food. In some cases, they may prefer only soft foods or liquids, or they may simply refuse meals altogether. Weight loss in the final stages of life is often accompanied by a general decline in physical strength, reduced mobility, and increased fatigue. Muscles weaken, making daily tasks more difficult. The individual may prefer to rest more often, and even sitting up for meals can feel overwhelming. This decline in appetite and body weight is not something that can simply be reversed with force feeding or nutritional supplements. It is a natural progression, signaling that the body is slowly shutting down as it reaches the end of life. As the body ages, energy levels naturally decline, leading to increased fatigue and a greater need for sleep. In the later stages of life, this change becomes more pronounced, with elderly individuals spending significantly more time resting or sleeping throughout the day. This shift is not just a sign of aging, but a reflection of the body's internal adjustments as it begins to slow down essential functions. Many family members notice their loved ones sleeping longer at night and taking frequent naps during the day, often feeling concerned about this drastic change in their behavior. One of the main reasons for increased fatigue is a decline in metabolism and organ function. The body is no longer able to produce or utilize energy as efficiently as before, making even the simplest activities feel exhausting. Walking across a room, eating a meal, or even holding a conversation can leave an elderly person feeling drained. Since energy is a limited resource in aging bodies, it is naturally redirected to essential functions, leading to longer periods of rest and sleep. Circulatory and respiratory changes also contribute to fatigue, As the heart and lungs weaken, oxygen levels in the body decrease, making movement more difficult and tiring. Many elderly individuals experience shortness of breath even during minor activities, forcing them to rest more frequently. In some cases, poor circulation leads to a constant feeling of heaviness in the limbs, making it physically challenging to stay active for extended periods. These physiological changes result in increased sleep as the body attempts to recover from even minimal exertion. Neurological factors also play a role in excessive sleepiness among the elderly. The brain requires a significant amount of energy to function properly, and as cognitive decline progresses, mental exhaustion becomes a common occurrence. Simple tasks such as processing conversations, making decisions, or recalling memories can leave an elderly person feeling mentally and physically drained. This cognitive fatigue often leads to longer periods of sleep as the brain attempts to recover from the strain of daily activities. Emotional and psychological factors further influence an elderly person's tendency to sleep more. Depression, grief, and loneliness are common in aging individuals, particularly those who have lost spouses, close friends, or a sense of purpose. When the mind lacks stimulation or engagement, excessive sleep becomes a coping mechanism. Many elderly individuals withdraw from social interactions, preferring to stay in bed rather than participate in activities they once enjoyed. This pattern can gradually lead to an increased dependence on sleep as a way to escape feelings of sadness or isolation. Chronic illnesses and medications also contribute to heightened fatigue. Conditions such as heart disease, diabetes, kidney failure, and arthritis place significant stress on the body, leading to persistent tiredness. Additionally, many medications prescribed to elderly individuals, such as pain relievers, sedatives, and antidepressants, can cause drowsiness as a side effect. The combination of illness and medication-induced fatigue can make it difficult for seniors to remain awake and alert for extended periods, reinforcing the need for more sleep. Changes in sleep patterns are also influenced by disruptions in the body's natural circadian rhythm. Many elderly individuals experience fragmented sleep, waking up frequently during the night due to discomfort, restlessness, or bathroom needs. These nighttime interruptions often result in increased daytime sleepiness, as the body struggles to maintain a consistent sleep cycle. Over time, this irregular pattern can cause seniors to feel perpetually tired, leading them to spend more hours in bed throughout the day. As sleep becomes more dominant in an elderly person's daily routine, their engagement with the outside world gradually diminishes. They may respond more slowly to conversations, show less interest in eating, and become less aware of their surroundings. The shift toward prolonged sleep is not just a response to tiredness, but a natural adaptation of the body as it prioritizes rest over activity. As individuals age, a noticeable shift in social behavior often occurs, with many seniors gradually withdrawing from conversations, social interactions, and daily activities. This withdrawal is not always a conscious decision, but rather a natural response to physical, emotional, and psychological changes. Elderly individuals may begin speaking less, avoiding gatherings, or preferring solitude over interactions they once enjoyed. While family members may interpret this as sadness or disinterest, it is often a complex combination of factors that influence their gradual retreat from social engagement. One significant reason for this withdrawal is cognitive and sensory decline. As memory fades and processing speed slows, participating in conversations can become mentally exhausting. Struggling to recall words, keep up with fast-paced discussions, or recognize familiar faces can create frustration and anxiety, leading seniors to withdraw rather than risk embarrassment. Hearing and vision impairments further contribute to this isolation, making it difficult to engage with others in group settings or noisy environments. Over time, they may begin avoiding social situations altogether, finding comfort in silence and solitude. Emotional factors also play a crucial role in social withdrawal. Many elderly individuals experience grief from losing spouses, lifelong friends, or even their sense of independence. The realization that life is changing in irreversible ways can lead to deep introspection, where they begin detaching from the external world. Conversations that once felt fulfilling may now feel repetitive or unimportant, and interactions that require emotional effort may seem overwhelming. This shift is often misunderstood by loved ones, who may struggle to reconnect with them as they retreat further into themselves. Physical exhaustion and declining energy levels further contribute to less communication and social engagement. Engaging in long conversations, attending gatherings, or even making phone calls can feel draining for elderly individuals who already struggle with fatigue. The effort required to be actively present in social interactions can sometimes outweigh the desire to connect, leading to an increasing preference for quiet and rest. As the body and mind slow down, the external world may feel less significant, and many seniors naturally begin prioritizing inner peace over social engagement. Chronic pain is another common aspect of physical decline, affecting the muscles, joints, and bones. Conditions such as arthritis, osteoporosis, and nerve damage can cause persistent discomfort, making movement more difficult and exhausting. Pain can also contribute to sleep disturbances, further weakening the body and reducing its ability to heal. Over time, the cumulative effects of chronic pain can lead to a cycle of inactivity, muscle atrophy, and increased frailty, further accelerating the decline in physical health. As the body weakens, the immune system also becomes less effective, making elderly individuals more susceptible to frequent infections. The body's natural defenses against bacteria, viruses, and other pathogens slow down, allowing illnesses to take hold more easily. Common infections such as pneumonia, urinary tract infections, and skin infections become more frequent, often requiring medical intervention. Even minor illnesses that were once easily overcome can linger for longer periods, leading to further complications and hospitalizations. Wounds and injuries also take longer to heal due to reduced circulation and slower cell regeneration. A small cut or bruise that once healed within days may now take weeks, increasing the risk of secondary infection. Bed sores, which develop from prolonged periods of immobility, become a serious concern for bedridden individuals, as they can lead to deep tissue infections and severe pain. The body's ability to repair itself is no longer as efficient, making even minor health issues more challenging to manage. Respiratory health often declines in elderly individuals, leading to an increased risk of lung infections such as pneumonia or bronchitis. The lungs lose elasticity over time, making it harder to take deep breaths and clear out mucus effectively. Many seniors experience shortness of breath, even with minimal exertion, as their lung capacity diminishes. This decline in respiratory function makes it easier for infections to settle in the lungs, leading to frequent bouts of coughing, congestion, and difficulty breathing. Digestive health also deteriorates, making it harder for the body to absorb essential nutrients. Many elderly individuals struggle with constipation, acid reflux, or loss of appetite, leading to malnutrition and weakness. A weakened digestive system can also make it easier for harmful bacteria to thrive, increasing the risk of gastrointestinal infections. As nutrient absorption declines, the body lacks the energy and resources needed to maintain strong muscles, organs, and immune defenses, further contributing to overall frailty. Frequent infections and physical decline often lead to a noticeable decrease in energy levels, making it difficult for elderly individuals to engage in activities they once enjoyed. Even simple tasks, such as getting dressed, eating a meal, or holding a conversation, can feel exhausting. This constant state of fatigue can make individuals withdraw from social interactions, further isolating them and reducing their overall quality of life. Providing support for an aging loved one requires patience, understanding, and a willingness to adapt to their changing needs. As they go through physical, emotional, and cognitive transitions, their reliance on family and caregivers naturally increases. Being there for them does not just mean assisting with daily tasks, it also involves offering emotional reassurance, respecting their independence, and ensuring they feel valued. Every small gesture of kindness and attentiveness can make a significant impact on their well-being. One of the most important ways to support a loved one is by actively listening to them. As they age, they may feel unheard or overlooked, especially when their opinions or concerns are dismissed. Taking the time to engage in meaningful conversations, ask about their feelings, and acknowledge their experiences helps them feel respected and understood. Many elderly individuals find comfort in sharing memories and stories, and showing genuine interest in their past can strengthen your bond with them. Encouraging independence is essential for preserving their dignity and self-esteem. While it may be tempting to step in and do everything for them, allowing them to perform tasks on their own, whenever possible, helps them maintain a sense of control. Simple modifications, such as installing grab bars in the bathroom or providing adaptive utensils for eating, can empower them to carry out daily activities safely. Offering support without making them feel helpless is key to fostering confidence and self-sufficiency. Emotional support plays a crucial role in their overall happiness. Many elderly individuals experience loneliness, grief, or anxiety, especially if they have lost a spouse or close friends. Spending quality time with them, whether through a shared hobby, a leisurely walk, or watching their favorite show together, can provide comfort and reassurance. Small acts of affection, such as holding their hand or giving them a warm smile, can make a world of difference in how they feel about themselves and their place in the family. Assisting with healthcare needs is another important aspect of support. Attending medical appointments with them, helping them keep track of medications, and staying informed about their health conditions can ensure they receive the proper care. Many elderly individuals struggle to articulate their symptoms or concerns to doctors, so being their advocate can help them get the treatment they need. Monitoring changes in their physical or mental state can also help detect potential health issues before they become severe. Creating a safe and comfortable living environment is essential for their well-being. Falls and accidents are common among the elderly, so removing tripping hazards, ensuring proper lighting, and arranging furniture for easy navigation can prevent injuries. If they require more assistance than family members can provide, considering professional caregiving services or assisted living options may be necessary. Making these adjustments with their input and preferences in mind helps them feel included in decisions about their own care. Providing social engagement opportunities can help prevent isolation and depression. Encouraging them to stay connected with friends, participate in senior activities, or even explore new hobbies can keep their minds active and spirits high. If mobility is an issue, facilitating video calls, arranging visits, or bringing them to family gatherings can help them maintain a sense of belonging. Feeling valued and included in social circles can have a positive impact on their emotional and mental health. Above all, practicing patience and compassion is essential when supporting a loved one. Aging comes with challenges, and there will be moments of frustration, resistance, or sadness. Responding with kindness rather than irritation, offering reassurance when they feel uncertain, and standing by them through their struggles can provide immense comfort. Letting them know they are loved, appreciated, and never alone can bring them peace and dignity in their later years.